And welcome back this morning on Today's Consumer. A major move to help millions of Americans pay for life-saving medicines.
Eli Lilly, the manufacturer of several insulin products, announced it's slashing prices. So what does it all mean, and will other drug makers follow in its footsteps?
NBC's senior consumer investigative correspondent Vicky Nguyen is here with what we need to know. This is significant.
Huge. Big deal.
How quickly could folks actually start to see the change?
This is effective immediately, Craig, and it's such a game changer. Think about this. 37 million people in this country have diabetes. About 8.5 million rely on insulin to manage their conditions. So this takes place right away, whether you have private commercial insurance or you're uninsured. Here's how it works. It's an out-of-pocket cap of $35 a month. You will not pay more than $35 a month for your insulin. For people with commercial insurance, it's going to happen automatically for you at about 85% of the retail pharmacies in this country. For the other 15%, what you need to do is go to Lilly.com and download their coupon with the barcode, and then you'll get that price cap as well. This is not the only drug we're talking about. Lilly is actually going to lower the prices for a few other insulins as well, including Humalog, which is their most popular insulin. That's happening in the last quarter, starting in October. But it's going to go from $275 a vial down to $66. So when we say it's a game changer, it really is.
That's a real difference for millions of folks. And of course, Eli Lilly, if I'm not mistaken, I think they cover roughly a third, or one of the three biggest companies that make this insulin.
Exactly. And 3 in 10 people who have diabetes use their insulin products.
To your point, though, what about folks who are not insured? What, if anything, do they need to do to benefit from this price cap?
Yes. So they absolutely can get this, but they will need to go and apply for the co-pay program. So you want to go to this website here, insulinaffordability.com. You apply for the copay program if you don't have insurance. Now, some folks have already been getting this price since 2020 because it was rolled out as part of pandemic coverage. So if that's the case, or if you pay less than $35 a month, then there are no changes for you. Don't worry about that. If you're private insurance, this is going to go into effect immediately. And we should mention Sanofi and Novo Nordisk. Those are the 2 other big insulin makers. They also have affordability programs on their website as well.
To be clear, this is regardless of income.
Regardless of income, exactly, and for everyone.
Insulin prices have been on the rise for decades. I hate to question a good thing, but why now? Why did they slash the price?
It's such a good question, and there are a couple factors here. One, pressure from lawmakers and advocacy groups. The CEO of Lilly said he's been talking to members of Congress, but the other part of it, Chanel, is competition. Look, the state of California is talking about making its own generic insulin. Mark Cuban's Cost Plus Drug Pharmacy, they too are trying to find ways to get insulin out to people for a lower cost. So I think that Lilly and some of these other companies are seeing the writing on the wall and saying we need to find ways to make this more affordable for everyone. And this little thing called the Inflation Reduction Act, that capped insulin costs at $35 a month for people who are on Medicare. The problem, Chanel, is that more than half of the people who have diabetes are under the age of 65. So this is going to bring it to everyone. And by the way, I want to mention in April, Lilly is developing a new product. They're going to introduce a new insulin. It's called Resvoglar. It's going to cost 78% less than the Sanofi's insulin of the same category. So you're going to start to see competition in this space really heating up, and that's such a big win for patients.
Well, speaking of competition, so what if you're using another brand and then yours costs more? Can you jump ship?
This was a good question I had. What's the real life application? Can I go onto this product and get that $35 cap? You do want to talk to your healthcare provider because different insulins serve different people who have different medical conditions. You definitely don't want to do a switch without talking to your doctor first. You can also go to Lilly.com/insulin. They're going to try to do a bunch of frequently asked questions and answers to help people navigate. And the main thing is never make a change without talking to your doctor. But the great news is there's so many more options now.
I mean, we talk so much about prices going up for everything. So to talk about prices being slashed, it's good news this morning.
And people not having to ration their medications is a huge deal.
Good.
It's the number of people who rely on life-saving insulin in this country. It's remarkable. So some good news this morning. Thank you for your good news.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.